Good afternoon, class. My name is Mitesh Raval, and this today's presentation is on the week six Soapnotes presentation. My topic this week, this was actually happened 2 weeks back when I have seen this young gentleman who comes to our clinic, which is at Bay Internist with Dr. Patel. The patient, he's 40 years old. His date of birth is 8/5/1980. Actually, he came here for his review lab. He was there before for his lab work. He's a young guy, so he never did most of the lab work, but he was planning to go to India. He wanted to do his lab work before traveling abroad. So this guy, he's MJ. He's a 40 years young man. He has an athletic build, and he's origin from India. He's not married. He's single guy, live in the uh, like with his girlfriend, uh, and his medical his medi his PMH, his medical problem. We call him to come and see us for because of his abnormal lab that we will talk about in detail. Patient surgical and hospitalization. There is no recent surgery or any hospitalization recently. He is pretty good about his immunization. He had his COVID vaccine done, and he all three doses, including the booster dose. No allergies. Medication, he doesn't take any over the prescribed medication or not even the over the counter medication. Family history, his father who owns the business, mom is a housewife, and his girlfriend that they're going to marry soon, who is a registered nurse, and he doesn't have any other siblings. uh, he doesn't take any he doesn't smoke, drink, or does any kind of uh, any drugs like illicit drugs outside. Diet, exercise wise, he's a vegetarian person. Vegetarian diet he consume. He doesn't eat any meat or meat product. He drink lots of plenty of water. Exercise wise, he doesn't go work out anything, but he does play cricket on weekend with his friends, and he eats regular food on time, two good meals at lunch and dinner. Social history, we talk about tobacco. He doesn't take any kind of tobacco, chewing or smoking or even vaping, nothing spiritually. Social support, he born Hindu. He does go to temples occasionally. uh, Review system, patient doesn't have any fever, chills, nausea, vomiting, no chest pain or shortness of breath. Uh, his overall system is remarkable. There is nothing going on. He doesn't have any issue and any problem going on at this point. The reason for coming to the clinic was to review his lab work. His physical exams, his vitals were stable, no fever or no high blood pressure at this time. Patient's weight is 169, which puts his BMI 24.2, which is normal BMI. His lab. So when we did his lab, his cholesterol was the high when the lab report come back. His LDL was 180, HDL 30, which is a good cholesterol, was low, and his triglyceride 240 mg, 240. Other labs were within normal, which was his hemoglobin is okay. They haven't done his thyroid panel, which we'll talk about this in the back and further talk. His physical exam, his general survey, he temperature, he has no fever, nothing. He looks pretty healthy looking guy. He's well dressed. He has a good eye contact throughout the interview and throughout his physical examination. Uh, and his physical examination is remarkable. No history, no lymph node swelling or nothing. He's pretty healthy looking guy. uh, but we did listen to his lungs. We did check his heart sound. S1 S2 were present. There was no abnormal heart sound or murmur heard at this time. Neuro-wise, he's alert-oriented. Now we talk psychiatric-wise, no behavioral change or any kind of depression or anxiety noted. Assessment. So after talking to the patient, review his lab, discussing with him all his lab values, we came up with the three differential diagnoses after talking to the patient. One was hyperlipidemia, which ICD code is E78.5. Um, BMI, his BMI was 24.5, which is high for his height and weight. So we did put for as our second differential diagnosis as a high BMI. Uh, the final diagnosis of this patient was hyperlipidemia. So plan for this patient was advising to include his exercise and some physical workout, while just not only the playing cricket, he need to physically more active, as because he works as an IT consultant, which is mostly job is to sitting and less physical activity. And another important, the whole think about this particular place to select was because I'm myself is Indian too. I grew up in India, and being an Indian descent, eating all even the vegetarian diet, that the people more has a high cholesterol, and we try to explain him about that, because even though you're not eating any meat or not smoking or drinking, why your cholesterol is high. The reason because there are a lot of milk and milk product that consume by him, because his parents lives nearby, they always bring over food and they always have invitation in the Indian families. So that could have be another reason that could cause his cholesterol level to go high, and decrease his good cholesterol. So that case makes me really interested to do more study and put it here as to discuss, because many people think about that, eating only vegetarian diet without doing any exercise or physical activity can make you more healthy. But no, because if you include in your diet more dairy and dairy products such as milk, yogurt, or the sweets made from the milk, or anything that has more milk product, could cause increase cholesterol level. And after we discussed, and then we did ask him to go through a couple of another lab for the thyroid panel or TSH, because sometimes if the thyroid levels are out of whack, it does increase the cholesterol level too for the patient, especially triglyceride. So that was another interesting things I would like to I was discussing with the patient. We did give patient a very good education about like increase his physical activity, try to change his diet and lifestyle, especially more the diet, kind of avoiding more India, more the milk and milk product or the dairy product from his daily lunch and dinner for things, and include more like vegetables, and make smoothie in the morning instead of having nothing in the as a breakfast. And another important things that we discuss about using the evidence-based practice and the holistic approach, by explaining the patient about that, the evidence shows that changing lifestyle and eating habits can help in reducing the cholesterol level and help preventing cardiovascular disorder. The diet high in dairy product has significant effect on the total cholesterol level, as we discussed above. And using the holistic approach by Dr. Watson's theory of human caring science, in this nursing theory by Dr. Watson, there are important things were outlined and marked important as a principal reflection on the powering the base patient care as performed by all healthcare providers, especially the nurse practitioner. Jan Watson theory of human caring science motivate mention about reflective or mediative approach towards their patient care at day-to-day work. One of the nurse practitioner uses or implanted Jane Watson caring science theory to their working practice. Instead of judging patient by his work habit or by not going to gym and all. It is not the right things to do, as mentioned by the human caring science. Every individuals are equal. We need to see them as a human being first before we treating them as a patient. That will help improving our patient care and a good outcome. So using Jan Watson theory of human caring science in my Soapnotes presentation was very helpful while explaining the patient and teaching and educating him uh, about his problem, or as a diagnosis as a hyperlipidemia, what we diagnosed. Thank you so much for listening, and I hope that helps other student to know about the cultural and the social aspect, what sense human um caring theory how affect overall patient care. Thank you so much.